Welcome to the next episode of Khanversation. I'm Muqtada Khan, a professor at the University of Delaware, and I'm the host of Khanversations. Today, we have with us a very distinguished and important guest talking about a very serious situation. We have with us Lt.Governor Bethany Hall-Long, who will be talking to us about the situation of COVID, which has become quite dire in the state of Delaware. I also have with me Ruhi Khan today, who is going to be co-hosting this show. She's a sophomore at Yale University, and she's home for the holidays. So Governor, welcome. Welcome to Khanversations again. It is unfortunate that we are talking about such a serious issue. The Governor Carney had a press conference in which he talked about the escalating situation of COVID in Delaware. And apparently the two hospitals, Christiana Care and the Wilmington Hospital, are at 115% capacity. There is no room. People are out there in hallways. So suddenly we seem to have a lot of hospitalization, which is exceeding the capacity of the state. So can you apprise us as to what is going on? How serious are these things?
Right. Well, it's a pleasure. Thank you so much to my colleague, Professor Khan, and as a Lieutenant Governor and a colleague of yours as a professor of nursing at UD. It's very serious. And I have to say that we are at capacity. We have the largest number of hospital admissions that we have had since the beginning of COVID. And I think our colleagues across the country have been hearing this as well. As immediate past chair of the National Lieutenant Governors Association, we often have dialogue, and all of us across the nation are very concerned. We are all seeing an uptick with the Delta at our hospitals. However, we know new cases are the new Omicron variant. So again, a lot of our cases have been, until this past week, the Delta, which still remains very serious, very high. And we are all really hoping people get the vaccination, get their boosters before we get the tidal wave of the new variant, the Omicron variant. So it's a very serious situation. If we have not had the full impact of Omicron variant yet, can you imagine? We are now having issues with hospital staffing, capacity. We no longer have elective surgery in the state for persons who, maybe have been putting off that new hip or that new knee, or having a repair, or unless it's an emergency situation, we have no elective surgeries right now. So it's very serious, and we're really concerned.
One of the things that happened at the press conference was that Governor Carney made it very clear that at this moment, he is not ready to have some kind of a statewide mandate with regards to COVID practices. And he's saying that people are already very tired of these mandates. But given the terrible situation that we are in, is there, as a nurse, as someone who is so intimately involved with taking care of people's health in the state of Delaware, and you've been so active with vaccinations, do you think that there is a tipping point where then the state would then have to impose some kind of mandates with regards to either vaccination or masking or social distancing? I mean, is there something in the heads of the administrators in the state of Delaware where they are saying, okay, we can go up until this point, and then beyond that, we will have to get tough?
Mm-hmm. Right. And, we had to make tough decisions, as you know, when we did not know what we were dealing with COVID, and the major tool in the toolkit, which was the vaccine. Recall, we shut down businesses, we shut down schools. It was a very difficult time, but in order to have that healthy economy, we had to have the healthy economy. And I had the privilege with our Secretary of State of chairing the Pandemic Resurgence Advisory Committee. And you're spot on. Government's whole reason and rationale for existence is public safety, and making sure that Delawareans stay strong. As a nurse, it has been a difficult time. As a professor, listening and working with colleagues across all the health professions who are suffering right now from some burnout and exhaustion because we've had these peaks and valleys. Right now, we are at that point across the nation, just not in Delaware. As Governor Carney had indicated, businesses have not been shut, but protocols are being really closely monitored. Outcomes and data are being monitored. The lab components, for example, we're having to closely look at virulence versus contagiousness. And that's some fancy epidemiological terms. I teach, believe it or not, public health and epidemiology. And we really have to see with the Omicron variant, one thing we know for certain, and it's so serious during the holidays, no matter your faith or your background, during these next few weeks, it is very infectious. It's very contagious. That we know. We must mask, even if you have been vaccinated. When you are out, protect yourself, protect others. We also don't know the level of virulence, which is case fatality, how deadly. We know that Delta and others, we've seen deaths rise, particularly for the unvaccinated. And we're going to be monitoring very closely the Omicron variant and what it means for individuals. I can tell you this flat out, every nurse I've talked to is taking care of clients in the ICU and the EDs. Even for the small number who have been admitted, who have been vaccinated, many have underlying disease. They would have absolutely, had they not been vaccinated, they would have ended up probably in our ICU, on our ventilator, or God knows, much higher case fatality death rates. Vaccines are our best tool. They are so important. And if you haven't had your booster and you are now eligible, get boosted. Really important. And for children and parents, we didn't think twice about our smallpox vaccine for our children, diphtheria, pertussis, measles, mumps, rubella. These vaccines have been tested. So we're going to monitor really closely. I don't think anybody wants to have to shut down again. Public safety is always top priority. And I know it is for Governor Carney.
You mentioned Omicron multiple times, so and what the future of Omicron could potentially be. But what is it currently in Delaware, and what is its presence, and what do you predict as we are monitoring?
Now, we know we have Omicron in our communities, and we are not able to pinpoint the exact number or exact persons. We certainly know when our first cases were diagnosed in the state. But what it means is we are going to continue to see the admissions to our emergency rooms, emergency departments rise. We're going to see additional sickness and caseloads increase. And we're going to have more cases, which we're seeing. We're going to have a lot more cases and testing positive. So the best way we can determine and protect ourselves is to be tested for COVID. So before you gather with communities or at functions, whether at a mosque, a synagogue, for those who are of Christian faith, we know it's going to be a big holiday coming up. So with your colleagues, your friends who may be in close quarters, who may be tempted, they have a false sense in a crowd that they're protected and they don't want to put this wonderful mask on. I live pretty much with my mask. I feel naked without my mask. Rui, thank you for that great question. We predict a rise in COVID cases, a rise in infectivity, and a rise in possible deaths, particularly those who are unvaccinated. They're at great risk. So please, get vaccinated. We have lots of resources and ways to get vaccinated or to get boosted. And if you choose not to, stay home, stay in, make sure that you're doing your COVID testing. Take this seriously. It's the only way around the globe in a pandemic that we're going to get out of this together across the world.
Ruhi and I both, and everybody in my family, are already boosted. But I've been reading reports. I've been reading reports that in Israel they have already started giving the fourth dose. They're calling it the fourth dose or the second booster dose, and they have been sort of ahead of most other countries, at least the United States, in dealing with COVID. So where are we going to be? I mean, we don't even have in Delaware, apparently between the ages of 18 to 34, only 60% have had at least 2 doses. So we haven't even had the whole state get the 3rd dose. And I'm sure very soon we will be talking about the 4th dose. And people are clearly implying that because Moderna works so well with Omicron, perhaps even if you have not had Moderna in the first 3, the 4th dose could be a Moderna booster. So why are we lagging behind, even in blue states like Delaware, when it comes to vaccination?
And the whole vaccination thing is quite fascinating. I was actually vaccinating today and yesterday, and believe it or not, I've only taken 2 days off the whole year, including weekends, and I vaccinated myself over 3,500 persons. And we need to make the understanding that, yes, the 18 to 34-year-old group a lot of times feels, invincible or doesn't feel like they're going to get sick because they have a healthy immune system. They're at great risk as well. Women who maybe conceive and get pregnant, everyone is at great risk. They also have a lot of myths, right? Oh, it's going to affect my fertility. We need that age group in particular to increase. We've worked a lot in the community around issues called equity. And when we talk about equity, we're meaning communities of diversity and color. And that's why through the pandemic advisory and my office, Lieutenant Governor, has hosted weekly and monthly meetings with faith leaders, Black leaders, Latino, and different leaders across our state, strategizing how we can get not only shots in arms, but mask out, educational materials. And also, let's face it, it's been 2 stressful years. So we've had to put a lot of energy into making sure people have access to behavioral health tools for anxiety, depression, social isolation. And we've had the twindemic, the opioid epidemic occurring during the pandemic. And that's an area I've spent a lot of time. And so we're encouraging anyone who maybe is at home in isolation, if you call 211, we have a couple of things we offer now. We have a homebound program for persons who can't get out and get their booster, for example, who may have a physical disability or other challenge. And we have a lot of resources for individuals who may have some emotional turmoil, emotional stress. So there's a lot of balls in the air, so to say, that we're juggling. But I am, optimistic for Delaware, but I am not. I'm very concerned. I'm very cautious right now on our jobs, our economy, our universities. This is a critical point, and it is so, so important that we follow these simple instructions, of distancing, just celebrating with your immediate family. Even if you're out and about and you've been vaccinated and you're in stores, crowded places, arenas, wear your mask. You may not feel sick. You can be a carrier. You can potentially infect another person who could take it to a child, a 2-year-old, or the great grandmother, who's 90 and frail. So again, it's about all of us, working together to keep one another healthy so that, in a year from now, hopefully we're back in December and we can go, we made it through. But this challenge through a pandemic is going to be recovery that's going to probably easily go into 2024 or 2025 when you talk about the economics and the infrastructure challenges. And so let's all do the right thing, protect ourselves against the Omicron variant, get the booster, call 211, work with your leaders such as yourself, and get vaccinated.
Thank you so much for everything you do, not only as a lieutenant governor, but also as an individual and vaccinating people personally. I think it's wonderful that you're doing that. And you've given a lot of really great ideas for people, especially with the holiday season. A lot of people are visiting family. A lot of people are coming into Delaware, out of Delaware. And I wanted to ask, what is the role of testing in this, and where can people get tested?
Great question. In our state of Delaware, if you go to de.gov/coronavirus, we will provide for you a list of all of our free testing sites. Also, you can go to any state service center, all of our independent pharmacies, so even the ones severed from the big names, CVS, Walgreens, Rite Aid, they're their big names, and our grocery stores that have pharmacies. But we have a number of independent pharmacies that have been open, and Delaware has hubs where you can also get testing. But also you can go online and they will mail you right to your door, to your house through the Vault, VAULT, a home testing kit that you can then easily also mail for free back and get your results. If you're going to be with family, get your PCR, get your testing done a couple days in advance. Buy at your pharmacy a testing kit if you can get them. A lot of them are sold out. They're actually capping the number that you can get, but be sure to get those. Some of the ones you order online may not be quite as effective as some of the others. So again, make sure you're getting a legitimate test. Also, little tips. If you are in a congregation, a setting, it's actually been pretty nice here in Delaware, the weather. Have doors open, have a window cracked, if you're in a room with family who have all been vaccinated. This is not the time to go to the New Year's party at the neighbor's house or to go visit at a friend's home for prayer or to visit where you have lots of individuals crowded into a living room. It's just not smart. And if you are going to be visiting, do the things you know from the past 2 years, washing your hands, keeping your distance, wearing your mask. And it's okay if you get into a setting where someone has cordially invited you and you don't feel comfortable, you can just say, thank you so much. I only have a few minutes. I need to leave. Also, I personally have been very lucky. I have not been infected with COVID, and I have been on the streets starting in March of 2020, testing. Of course, I was in PPE, kind of like undercover Lieutenant Governor, but actually on the streets. And one of the things that has helped me the most is providing those guidelines. But I love people, but I don't shake hands. And I know culturally in some ethnic groups, we shake hands, some we don't. Some we are very close or we hug. Again, it is okay right now to not shake hands. And again, I know that might be a little difficult depending on your listening audience and community background, but I have found little things, opening windows, keeping my distance, washing my hands. I think my hands are just conditioned with sanitizer. And I also have, really good masks. And that is important. N95, if they're traveling and you're on a plane, you wear an N95 mask. Keep that on in the airport. Bring your, try not to, unless it's a long distance flight, wipe. So when they bring you water bottles, you wipe it down. I mean, it sounds crazy, but everything I touch, I think about. And we're going to get through this. And there's going to be a fun day when we're not going to have to do any of this. And we'll look back on this and just maybe like our annual flu shot, we might just have an annual COVID shot. And that's a good thing I forgot to mention. Our flu cases are up in Delaware. Last year, they were lower because we had a lot more people wearing masks. This year, it's back up. So if you haven't had a flu shot, please get your flu shot. Very important.
I want to tell my listeners that I'm going to be posting all the links that you mentioned in the description of the video below, so they can click those links and get information about testing, about vaccination, and other information that they need to know about the state. Yeah, I also want to thank Lieutenant Governor for doing such a fantastic job. It is quite fortunate for us that you also are so focused on the healthcare of the state. And I also want to thank Ruhi Khan for helping me out today. And for all the listeners, please listen carefully to the message that has been shared. Share this message with your friends. If you have not yet subscribed to Khanversations, please subscribe to Khanversations. Even if you don't like the message, please pay attention. It is a matter of your health. It's a matter of the health of the ones that you love. So thank you very much to both of you. And with that, over and out.